welcome everybody. Good morning on this very beautiful and sunshiny day here as part of the Loddon Mallee here in Bendigo. We have a beautiful sun shining just in time to help us shine a bit of a light for our Care Forum for 2025, where we're focusing on willing, capable and confident. I think of workforce, I think of communities when I see that title and that heading. So for those of you who may be new to experiencing a care forum, it's set up as a webinar from the incredible Women's Health Loddon Mallee team and our wonderful guest speakers, which Hayley will introduce you to in a few moments. So I would just like to begin by acknowledging the lands that we're on here today and also the theme of our care forum extending into building respect and equality in Loddon Mallee. So the acknowledgements that I bring you today come from the lands of the Dja Dja Wurrung people here in Bendigo, but knowing that so many of you will be on other incredible lands across this beautiful Kulin nation. So I would like to acknowledge the traditional custodians of the lands on which all of us are on here today as we live, work and play. And for us to celebrate and respect the unique cultural and spiritual relationship that Aboriginal and Torres Strait Islander people share with the lands, skies and waterways, and the ongoing contribution their cultures make to the life of our regions. Now, as we pay our respect to elders past, present and emerging, I would like to pledge our commitment towards reconciliation and justice. And we recognise the strength and resilience of all Aboriginal and Torres Strait Islander peoples, a resilience that has remained unbroken for more than 60,000 years, and that we are dedicated to a future in that all people and Aboriginal and Torres Strait Islander peoples feel connected, empowered and safe within the communities of the Loddon Mallee regions. So I'd now like to hand over to one of our incredible team members here at Women's Health Loddon Mallee, and that is Hayley Davies, who a lot of you know quite well through the Care Forum and also our care partnerships. And Hayley is our prevention of violence against women health promotion officer and one of our health promotion leads here at Women's Health Loddon Mallee. So Hayley, let's begin. Over to you.
Thanks, Kelly. Welcome everyone. For those who don't know me, I work in the team at Women's Health Loddon Mallee, working in the mainly, coordinating the care partnership, which is a partnership that most of you are members of. We also have people from organisations that are, allies and stakeholders in the region, and we also are welcoming people from outside the Loddon Mallee region today. So, welcome everybody, and thanks for that acknowledgement, Kelly. So that's Kelly, our not so new CEO, and I'm glad you're getting to meet her today as well. Just a note that this event's being recorded, so if you don't wish to have your face displayed, feel free to pop your camera off, but we do love to see your face. If you'd like to activate closed captions, you can hover on the bottom of your screen and the 3 more dots will come up with the closed caption option. And to just give you a quick sense of the flow of the session today, we'll just give a really brief overview of what we learned from the 2023-2024 annual Care Partner Survey responses. So essentially what you told us. And then we're going to hear from 2 fabulous care partners, as Kelly said, who will share case studies from primary prevention initiatives that they've been involved in or leading in the past 12 months in their organisations. We'll have a quick break we'll aim for about 11 for a bit of a comfort break. And then the second half of today's event will be unpacking Respect Victoria's fabulous new report, well, new from last year, Willing, Capable and Confident, Men, Masculinities and the Prevention of Violence Against Women. And we are so excited to be welcoming Tarang Chawla to facilitate the second half of today's session. And Hazel Donley from Respect Victoria will be unpacking the key findings of that report. And we'll have a panel discussion including Tarang, Hazel and Dr Innocent Mwatsiya from Trobe University as well. So, and of course, we'll check in for some feedback from you at the end, the ubiquitous evaluation. So, get started. For those who may not be aware, CARE stands for Collective Action for Respect and Equality, and the partnership was established to build workforce capacity and support organisations in the Loddon Mallee region to engage in initiatives and activities that collectively contribute to the primary prevention of violence against women. So CARE kind of provides a structured, collaborative relationship where organisations interact as they're able to and in areas that are relevant for them. And the partnership's guided by the CARE strategy in 4 key areas to encourage a shared agenda. Sometimes it's hard to keep primary prevention on the agenda, so whether it's cross-sectoral or organisation-wide, really keeping our aligned purpose of the primary prevention of violence against women and gender-based violence at the centre and always on the agenda. Systems change, which is looking at ways to build our organisational capacities in primary prevention, so policies, practices, planning, and our workforce capacity building, and cultural change, which is about creating safe, empowering, and inclusive cultures, challenging those harmful attitudes and beliefs, and building skills in primary prevention to sort of, encourage and enable knowledge transfer, which is in action today. And the CARE Forum is one way that knowledge transfer occurs, where we can all connect and kind of continue momentum and learn from each other's work in this space. So at the point of the end of June last year, when the survey ended, we had 31 CARE partners across the Loddon Mallee, and that's since increased to about 35. And each year the CARE partners, as I mentioned, complete a survey to help monitor progress of primary prevention efforts. And so we have a set of workforce capacity building indicators that we do that with, and also some questions around continual improvement for the partnership. So this year we've adjusted the survey to be shorter and hopefully easier to complete, which will be music to some of your ears. And the 2024-2025 survey will arrive in all CARE key contact inboxes on Monday, the 23rd of June. So look out for that one. Okay, so what we learned from the survey, just a few quick high-level snapshots. Leadership support is the #1 enabler for CARE partner activity, and a huge component of that is not only permission to attend, but to also prioritise attending primary prevention training or events and communities of practice. And unsurprisingly, the lack of time is #1 barrier. And many CARE partners reported that they're engaging in primary prevention work in addition to substantive roles, often with no extra resourcing to do so. We have 70% of CARE partner organisations who are defined entities. That means they're implementing gender equality action plans and need to report their progress every couple of years to the GE Commissioner. And so, as I said, some are doing this with some extra funding from Free From Violence, and others are doing it with little to no additional resourcing. So the activities offered through the CARE partnership may be able to support your organisation's GAP, they're affectionately known as activation. And actually one of the case studies being shared today talks directly to what that can look like. So that's a really nice thing to be able to share today. You told us that your top priorities for engaging in the 4 key areas of the strategy were to share learnings and take the opportunities to network. So one thing we'll be doing in the next 12 months is to look at more ways to enable that, to undertake training offered through CARE, and also to develop policies and processes that support the social change that needs to happen. So that a lot of that will be occurring in the GAP, I'm sure. And so lastly, what we'll strive to do in the coming year is, as I said, increase those opportunities for sharing and learning and keeping updated and networking together. And we will look to expand, kind of continually expand really our available training programs and to increase ways to be able to celebrate successes. And I think that the lovely Tina and Corrine, who are supporting me today, hello, they are popping in the chat a link to be able to join the care partnership if you're not from a care partner yet and you'd like to have a look, check that one out. And now I am going to stop sharing my screen so that we can get on with the interesting bits. Whoops, press the wrong button. Stop sharing. Fabulous. That's easy. It's so nice to see you all. I couldn't see you before. So we have two amazing case studies being presented by care partners today. And I would like to introduce Lisa Richards, who is the Community Projects Officer at Macedon Ranges Shire Council. Lisa's going to share some valuable learning in their community engagement project during 16 days of activism last year. And then at the end of Lisa's presentation, she'll pass the baton to Felicity Weissman, who is the Community Partnerships Gender Equity Officer at City of Greater Bendigo. Felicity is and the team engaged their staff to activate their GF actions around menopause in the workplace last year, and has even sort of created an exciting resource that we can share with you all too. So if you have questions for Lisa and Felicity, please share them in the chat, and we'll address them at the end of both presentations to try and make the most of our time. So welcome, Lisa and Felicity, and over to you, Lisa.
Thanks so much, Hayley. Let me just share my screen. I hope everybody can see that now. So yes, thank you so much for having me on to present a case study on a piece of work that Macedon Ranges Shire did for 16 days of activism last year. I would like also just quickly to acknowledge that I'm speaking to you today from Tongarong country and to pay my respects to their elders past, present and emerging. So for 16 days of activism, it falls into Macedon Ranges Shire's Tier 1 categories of recognition days that we adhere to and that we celebrate. So we have every year we have a reasonable program of things that happen during the 16 days, but we decided to do something a little different last year. This was partly because we had some feedback around a previous project that had been put together by council in another department, and also because of the councillor election period last year coming very close up against 16 days, it meant that we had to think slightly differently and a little out of the box as to what we were going to plan. So let me just, oops. It's been a while since I've used Zoom, beg your pardon. There we go, first slide. Oops. So our goal in this project was that we didn't have a public facing activity that like a collective activity planned. So we wanted, because we weren't going to do the walk against violence, which we would normally do because of the caretaker period causing some issues there. So we wanted to have another a format event that could engage the public. We were looking particularly at driving behaviour change through, pardon me, through the rigid, challenging the rigid gender stereotyping key driver of violence against women and male violence. So that was our goal. We wanted to do something that engaged broadly across the Shire, but also was around driving behaviour change. So in our planning, we had to think quite carefully about how we were going to do this, how we were going to word things. As I said, the project model was adapted from a photo competition that had been run for International Day for People with a Disability. It was a much smaller project that ran in 2023. we wanted to take it bigger than that, and we also wanted to get a really broad sweep across the community. And we spent quite a bit of time looking at how we were going to encourage those entries to really hit the mark for what we needed. So the wording that we came up with was that we wanted members of the public to send in images that show how we all live, work and play. So that was our key criteria in terms of location and place-based activity, outside of restrictive gender norms, where men can be gentle and caring, women can be strong and lead, and gender diverse or non-binary people can be active and visible in typically gendered spaces. We didn't want to be too prescriptive, but we felt we had to be somewhat prescriptive in order to really drive home the message. And then the format of the competition, we needed to work quite far back in terms of our planning. This wasn't something that could be sort of thrown together at the last minute, because we really had to map it out quite carefully in terms of giving people enough time to understand and interpret the message, take the photographs, upload the photographs, and conduct all the shortlisting. So we sort of had a 4-week period for a call for entries, which took place in October. So we were working quite far back from the actual 16 days. Those images were then shortlisted, printed and mounted. We displayed them from 25th of, in fact, I think we went slightly early. We probably put them up just the weekend before 16 days started. And then they also stayed up a little bit beyond the 10th of December. We also, we had them in an online sort of gallery that could be viewed as well. And we had a judging panel of professional photographers, then followed by an award presentation and celebration event, and then finally a sort of online component of People's Choice voting, which was announced at the end. So there are lots and lots and lots of moving parts. And it took a fair bit of planning and coordination with our internal comms team and other teams, particularly our youth team. We were very involved to actually get this all happening together. And of course, our partners. And so Macedon Ranges Shire partners every year. We have a little working kind of group every year that works together for 16 days. And so that is with Sunbury and Coburg Community Health, Zonta Club of Kyneton, and Macedon Ranges Health. And we also tap into our Schools Wellbeing Network and a couple of other strategic networks as well. So there was a lot of people working very hard on this. It was for such a big project. We had almost no budget, so this made it interesting. And we were successful in achieving a Safe and Equal grant towards this project, which was incredibly helpful. As you can see from the breakdown there, it really wouldn't have happened without those contributions. And we also had a very generous contribution from our partner, Sunbury and Coburg Community Health, and very importantly, strong in-kind contribution from a local business, the local framers, who, again, we wouldn't have been able to put this project together the way we did without those strong partnerships and strong relationships. And you can see Council's own people budget contribution was a relative drop in the ocean, but that's what we had available, and we were sort of scrabbling around for that. So it was a very low cost project, but high impact for what we were contributing. So I'll jump straight into some of the key challenges around this project. I mean, there were many, many challenges, not least of which we didn't really know until we opened it to the public what kind of images we were going to get submitted. It was very unknown in a lot of those respects. We didn't know how many people were going to submit. We didn't know how many pictures would get shortlisted and would need to be printed. But there was a lot of unknown factors at play in this. It was very important early on that we wanted to have a local venue with high foot traffic and publicly accessible to display the photographs. And we spent a very long time looking in Macedon Ranges Shire for a venue that ticked all those boxes. Initially, we had wanted to partner with the libraries, and they were very keen to partner to display the images, but libraries are very short on space. And when we actually had 15 shortlisted photographs, all sort of slightly bigger than A3 size. So finding a venue that could host all of the photos in one place was very tricky. And then the idea of breaking them up across the Shire was also potentially wouldn't show the impact of all of the images together. It was a little tricky for us to work out how we would divide them and split them across multiple venues. So we worked in partnership with a local cafe here in Kyneton, the Social Foundry, which is a cafe that is also a social enterprise, has very strong community values at its heart. They work quite closely with Sunbury and Cobourg and Zonta Club of Kyneton to put on events, and frequently during the 16 days. So they've been a previous partner in the 16 days. So they seem to they were like a #1 choice really when it came to a space that would be able to put up all the photographs and would be central and local and drive lots of foot traffic through. However, we ran into a little sticky situation on the actual day that we were hanging all of the shortlisted photographs. So the main challenge around this was really timing as much as anything else, which was that they had a moment where they really decided they didn't want to have one of the photos included. It's the photograph that you can see on your screen. Now, this submission met all of our criteria for shortlisting in the exhibition and in the competition. So we were placed suddenly in a very tricky position where they didn't want to have it in the space, and it was absolutely critical to us that it stay in the the online exhibition, the public exhibition, and part of the competition. So we had to very quickly scramble and work together to have some negotiations with the venue. We were able to work very closely with our partners in this respect, so particularly leveraging our relationship with Sunbury and Cobourg Community Health, who, like I said, run other programs that use the Social Foundry as a venue. We felt very clear around the decision that the photograph was absolutely to be included in the exhibition, because we had set up at the beginning of our planning, we had set in place terms of reference, guidelines, and selection criteria that we were meeting. So it wasn't just an arbitrary decision. It was very clearly met all of those criteria. And basically it came down to a discussion that was around values. And we luckily all together were able to place the strong kind of community values and emphasis on community wellbeing that all three, the venue, Sunbury, Cobourg, and Macedon Ranges Shire, all had as key priorities with this particular project. And then they were able to come to the party, and they were happy to have the photograph included in the end, which was, so it was all a little hectic, and it was all happening over a very short, like one day. But those negotiations were really, really important in terms of applying the learnings and the understanding around how to manage backlash. It was unexpected, so we were really sort of thrown had to think on our feet in this respect. We had incredible support, I will say, from Hayley and from Women's Health Loddon Mallee, and also through the other 16 days key organisations, Safe and Equal and Respect Victoria, but particularly the toolkit that Women's Health Loddon Mallee produced and the strategies around backlash were really important in this conversation. We were also able to provide then some further support to the venue in terms of scripts that were provided to staff, and lots of kind of management of feedback around with the community, directing it back to the project team. So that was back to myself and back to Rani at Sunbury and Cobourg Community Health to be responsible for any backlash that should come from customers. In the end, there wasn't any, but we felt that everybody felt well supported to be able to continue at that point. So it was ultimately a very positive outcome. It was extremely positive for the photographer, the person who had submitted that image, that they felt very well advocated for, very well supported. I think they felt an improved trust with their local council because we were so strongly supportive of their inclusion in this competition. And just quickly, I don't want to take up too much time, but basically the learnings and opportunities were very rich coming out of this project. We had a lot of youth engagement. We had, I think, 6 youth entries out of 15. I think 5 were shortlisted, and lots of young people came to the opening, which for a Thursday afternoon in Kyneton, that was pretty cool. We were happy with that. one learning was that we had reports back from young people that they didn't actually have access to the sort of digital cameras that they would like to use to submit entries. And so we're planning workshops this year to facilitate that. We thought young people all have phones. We didn't think about access to equipment, but that was quite strong feedback that came to us. So we will be working to support that this year. The online voting was the other component that worked incredibly well. We had 110 individual votes counted as everybody jumped on board to vote for their friends and their family and their favorite images. And so, and by the way, the previous image that I just showed you, that was the People's Choice winner and also the youth category winner. So we were very pleased that it did get included in the end because it swept the awards board. The other thing that we hadn't perhaps anticipated was that we asked entrants to provide a written description of their photo and how it responds to the question of challenging rigid and harmful gender stereotypes. And the very, very moving descriptions that were submitted with the photographs were just they enriched the experience so strongly. So we will definitely be working with that and see whether or not we can take some of those first person stories and do something a little bit more with those this year, because it was unexpected, but it was a real bonus. We also developed some potential partnerships with new community groups that work specifically in the gender equity space and the kind of creativity space in the Macedon Ranges. So that was a real bonus that we hadn't perhaps anticipated. And then, of course, there's an opportunity here. We've had lots of interest from other LGAs to scale this project beyond the Macedon Ranges Shire. So lots of fruitful things came out of this rather experimental exhibition that we put together. And this photograph, by the way, was the winner in the adult category. So I'm just going to finish at this point with what we felt was one of the real sort of most uplifting and positive outcomes that came from the exhibition. One of our judges, we had 3 judges, the fabulous Ciel, who I believe is no longer with Women's Health Loddon Mallee, but we were very, very pleased to have Ciel as one of our judges. We had Mitch Navalis, who is a photographer and filmmaker, as one of our judges. And then we had Council's photographer also stepping in to judge. So across those 3 people, we felt we had a good representation of people familiar with photography as a medium and people familiar with gender equity and the key issues that we were trying to address in this exhibition. So I don't know if you've had a minute to read that quote, but Mitch gave a fabulous speech at the opening, speaking very passionately and strongly around the importance of showing images like this in a cafe in a small regional town. This was exactly what we were aiming for with in our planning. Was in terms of venues, it was really ideal for us because there was lots of opportunity for incidental engagement with that key driver of violence. And the one piece I think that we would like to improve for next year is around working a bit more with the visitors to the exhibition to get feedback on how that may have infiltrated their conversations a little bit. It's something that's a little unknowable at this point. But yeah, we were very, very pleased and very proud to have Mitch as a judge, and very passionate speech that they gave. And of course, the image got shared on social media. So that was also pretty exciting for us that it was an image that went out to the world, the broader world. And that's me. So I'm now going to stop sharing and I'm going to pass over to the fabulous Felicity.
Hello, everyone. My name is Felicity Weissman. I'm from the city of Greater Bendigo and coming from Djadjawurrung country. And Lisa, as I said before, it is just such a wonderful campaign. If we could do anything like that, replicate that in Bendigo, I would jump on it in a second. And just it's proof that clever, creative thinking doesn't have to cost a lot of money. Great ideas don't cost a lot. So congratulations, brilliant. This one, I'm going to be talking about menopause in the workplace. And so you might recall back in 2023, the Victorian State Government did a Listening to Women's Voices landmark survey, and that showed this strong correlation between health and gender equity, and revealed what most women knew to be true, that a gender pain gap existed and that it exists in the workplace too. And so women were reporting that their pain was being minimised or dismissed, or just not visible and by medical practitioners. And as I've been reading a lot of literature about this, addressing menopause and menstruation in the workplace has been coined the next frontier of feminism. And so this survey led to the inquiry into women's pain last year, which then led funding for endometriosis and pelvic pain clinics specifically to address women's pain. And so the first one, there was one in Bendigo too, which was very exciting. And so in our Gender Equality Action Plan developed back in 2021, we had 2 actions dedicated to consulting staff about their experiences of menopause in the workplace, what meaningful workplace support mechanisms look like to them, and then us implementing them and raising their profile. And this included actually naming periods, menstruation, menopause, endometriosis in our workplace vocabulary and normalizing the terms. However, because this has been a taboo or sensitive topic, it's sort of sat in this, how are we going to approach this basket, for a long time, simply because we just didn't know the best way to address it. We want to address it, but we want to do it in a way where people don't feel exposed or uncomfortable. And so it sat there for a while. And with a large workforce, we have 222 women in the 40 to 55 age bracket who are potentially navigating perimenopausal or menopausal symptoms. So it's a very real issue for a lot of people. And then Women's Health Loddon Mallee announced that the Care Partnership was hosting an online menopause-friendly workplaces workshop. And instantly, I just knew this was the exact opportunity we needed to leverage to engage our staff by bringing in expert voices and then having a reason to sit around and chat about menopause in the workplace. So what helped facilitate this, I guess, from a systems point of view, was that we have this online MS Teams group at the city called the GE Feed. And the reason I set it up this way was for it to be like, every time I see a great article or an interesting, just something interesting related to gender equality, I can't email 100 people. Like, it's just, yeah. So it's just this way of being like short, sharp things that anyone who's vaguely interested in gender equality can just be sharing with each other. And so, yeah, so it could be, you know, celebrating the first time. You might recall that the women's cricket grand final in Bendigo was held at the QEO for the very first time, or that the Inquiry for Women's Pain survey is live, or whatever it is. And there's over 100 staff who regularly engage with it. So I posted about this upcoming menopause-friendly workplaces workshop, and it really hit a nerve. And a colleague at the depot posted on this post, she commented saying, everyone, this has prompted a huge response out at the depot. And then that made me think, because it had been actually quite difficult to engage a lot of the staff at the depot, but suddenly it was spreading like wildfire at the depot. So I thought, how can we actually get as many people engaging in this as possible? And so I reached out to Hayley and said, instead of us, you know, registering individually, could we have group viewings at the depot and at Galkangu? And she said, yep, go for it. We can make that happen. And so we had 43 staff register, and staff found the concept of openly discussing a taboo workplace topic really refreshing. And so it clearly indicated that reproductive health and the workplace really do intersect. So the day came, and unfortunately there were technical issues, as they always are, which had an impact on engagement. However, it was still really meaningful. And afterwards, so it was great just hearing from all the different experts and just having those time. Yeah, it was very expertly led. And then we had these discussions, and staff came up with 30 workplace supports that they really wanted to see in our workplace. And what is interesting, and what I've always found from collaboration, is that when you collaborate and when you consult, the more you do it and the more voices you're asking, you generally see themes very clearly come up. And so there were some strong themes, and I'll just speak to some of them. So staff really wanted a private enclosed breakout space and wellbeing rooms in all the city workspaces. And so a quote to support that was, "When the pain is really bad, I can't sit down, but I can still work reclined with a heat pack when I'm in the office. And I'd like to do that in private with some privacy." There were requests to improve bathroom facilities across the city workplaces because we don't often talk about toilets collectively. Now that we were talking about menstruation and menopause, toilets came up and inequities in different workspaces. Why does our toilet, the window doesn't close, or why can't it lock, or things like that. So that was interesting. There were some really clear frustrations about facilities. For the need for outdoor staff to have alternate duties when the pain is really strong. So a quote was, "I want management to figure out alternate duties for people suffering symptoms rather than being forced to take sick leave." There was requests to have desk fans and designated meeting rooms and desk zones which have different temperature settings so that you can just go, you know what, I'm having a heat flash at the moment. I'm going to go over there and I know that it's cooler, or whatever it is that you can just navigate the office that is supportive to your needs. And then to raising awareness of what period pain actually feels like and how debilitating it can be, and getting male people managers to really understand it. So a supporting quote was, "It's not a pain where I can pop a Panadol and feel better. I feel like I'm genuinely losing an organ." And then to have flexibility at work policies that can flex for waking up in the morning with acute pain and needing to work from home, but not needing to take sick leave. So I'm not sure about your flexibility at work policies, but generally it's, when do you want to work remotely? When do you want to work in the office? Tell us a year in advance. It's not responsive to your needs on a daily basis. Whereas menstruation and menopause, you do need that flex on a daily level. And so the supporting quote there was, "When I'm experiencing symptoms, I know what I need and I know what I need to do. I know how to manage this. I just need trust to allow me to do that." And then also wanting reproductive health leave in the enterprise agreement. And a supporting quote from someone was, "I've spent all my life caring for others, but never for myself." And so to have leave authorized, you're in pain, you can actually take leave for that. And it doesn't impact your sick leave. And recognizing the pain is unique for people experiencing menstruation. So these discussions showed, as I said, that our bathroom facilities weren't of the same standard across city workplaces, and that was impacting how staff felt valued in the workplace. Why is this workspace more valued than our workspace? Are they more valued than I am? And as a result, we organised property services and female depot staff and myself to do an audit of all the bathroom facilities and fix the issues that female staff identified. And this was actioned earlier this year. And they were very skeptical of this actually ever eventuating, but it did. And they were fixed, and it really communicated value to staff at the depot. And to also prevent any inequities occurring in the future, because when I was asking, how long has this been an issue? Do you know who to speak to? Have you spoken to anyone? It was this, you know what, I don't know. I don't know who the best person to speak to. I'm not really sure whether it will get fixed. So we spoke with property services and said, what is the best and quickest way for someone to alert that there's a maintenance issue that we can get fixed? And so they gave us a QR code to a direct form, and we put maintenance posters up behind every toilet cubicle around all the workspaces that just basically said, take a photo of the issue, upload it, and we'll get it fixed for you. And then in terms of, did we get reproductive health in our EA? No. And I don't think we were ever expecting that win so soon. And I think that's where the state and federal government really have a role to play in setting the bar, in pioneering change, in setting the standard of what is to be accepted in the workplace. And I fully expect that in time we'll start to see more and more organisations such as ourselves adopting reproductive health leave as it becomes more normalised and less pioneering. And then because there were so many, as I said, 30 support mechanisms that have not all been supported or implemented, but there were some little wins. What are these little wins doing at a broader level? I liken it to yeast in dough, where these little wins are compounding to create culture change that becomes visible over time. And have my expectations been moderated working in a large local government setting? Yes. I think the saying, if you want to go fast, go alone. If you want to go far, go together, suits me, because I feel like I'm a person that works fast, and I'm like, if we all work fast and we all believe this, we can go far. We can work fast and far. We can go fast and far. But I think there's enough, and I think there's enough best practice examples for us to do that. But local government is a slow moving ship. And I think the most enduring ones are the ones where the wins compound over time and you bring the most people along with you as the ship turns, and are most appreciated when you look back at 5-year marks. And I truly think we have achieved meaningful outcomes on the back of legislation, programs, funding, and partnerships like the Care Partnership that authorises and accelerates this change. Such as, would we have done menopause in the workplace consultations without the Care Partnership? I'm not sure, but definitely not as effective as it was. So thank you very much.
Brilliant. Thank you so much, Felicity and Lisa. I'm sort of like trying to suppress my excitement because it clouds my thinking, but I guess I get so emotional actually hearing your story, Lisa. I think that it's an incredible story of advocacy and partnership work, and yeah, it can be scaled. So I just want to encourage people to ask any questions in the chat, or if you feel comfortable, you can even come off mute, put your hand up, and I'll let you have the floor to ask questions. We've got lots of comments coming through that, it was a fabulous case study to share. And I guess I do have one question just while people might be collecting their thoughts. You mentioned a lot of unknowns with your Free to Be Me project, Lisa. So how would you recommend navigating unknowns, like knowing what you know now, if someone was to do a project, a community engagement project like that?
Yeah, I mean, I think the biggest unknown in planning was not knowing how many entries we would get and how that might affect our budget, which was very small, as you saw. So we just had to set a bar and say, we think this is going to make a strong exhibition. If we can get 10 or 12 entries, that will work for us. And that was the goal that we set. So although it was a strong unknown, we just had to plan around a goal in that instance. And this year we would do it differently in that we can look at what's happened before and go, okay, well, we can perhaps adjust that goal based on what we know worked. But we also, then had to back that goal up with making sure that we had enough budget to cover additional prints if we needed to get them made, or make sure our comms planning was really, really thorough so that we were pushing the messages out really clearly and being very strategic about who we were engaging with to drive entries. So yeah, it was a lot of planning and a lot of just kind of trust.
Yeah, great.
Yeah.
Yeah, we've got some questions coming through. Firstly, if your case study is available, Felicity, for sharing, we could share after this event potentially.
Yeah, sure. And I think the one that we wrote together, potentially, Hayley, that's available through Women's Health, we could easily share that one. That's ready to go.
Okay, fabulous. We can share that again. Yeah. Just looking at the chat, there's another question. How did you promote, Lisa, the concept and competition?
So the basic promotion was through our webpage, through socials, and through community outlets, newsletters, that sort of thing. We had a poster. We kept it quite broad, and I think because we didn't know what we were going to be working with, so I think that might change this year. We at least have some images now from last year that we might use in promotion this year. But when we didn't have anything at all, we played with ideas of whether or not we should be prescriptive in showing people what we wanted them to send, and in the end we decided not to, and we just use an image of somebody taking a photograph, because that was a much stronger message to drive actual photographic entries. So yeah, we took it right back to basics, and we leveraged every single network across council that we could, and all our partners networks as well. So lots, like I said, lots of strong youth engagement, and then out to our partners and networks.
Great. And there's a little question about what you offered as prizes as well.
Oh, well, that was, yeah, the prizes was good. We knew we always wanted to have prizes, and so we budgeted, well, again, in negotiation with the framers, once they had given very generous in-kind contribution, they said immediately they wanted to contribute framing vouchers as prizes, and that also freed us up to be able to use some of our grant money towards. So we actually had cash prizes, which
Excellent.
was very popular.
Yeah, especially for the youth, I'm sure.
Especially for the unpaid. I think even for the adults to feel like they were being taken semi-seriously as, you know, sort of they were all amateur photographers, but just that kind of semi-seriousness about the value of art, it lent something to it.
Absolutely, that sends an extra message, doesn't it, about value of art. And somebody's asked, Felicity, why did your age range stop at 55? Because lots of women are going through menopause past 55. Is that in reference to, anyway.
Yes, that would have been in reference to the 222 women within that age range. Yes. Yep, great point. Take that. Yep, note that.
Yeah. Okay. Any other questions? I'm not seeing any hands up, but Felicity, what are the ongoing conversations and areas of negotiation with the city's management?
Yeah. It's really interesting because I feel like I will be advocating in all different angles. So I think the enterprise agreement is the one where I think we sit down for about a week and do benchmarking with all local governments and try and put together the strongest evidence-based reasons why we should include what we do, and then inevitably some of those will go through, and that's great, and a lot won't. And then it's interesting because I guess a lot of women who are in people management positions are going through menopause, actually. And so it's in an interesting one because I'm not sure whether that sort of they really identify with the need, but I'm not sure whether they feel comfortable to be really vocal about it because it might feel too personal. I'm not sure. So it's I feel like it's finding what is an area that I'm advocating for that is gaining somewhat reception, and then just really work with that. And so, yeah, I guess it's putting all out there and just knowing that some is going to fall, some won't. And if you press too hard when there is a clear red flag, no, we're not interested, it can really damage relationships. So I think it's constantly being it's interesting when you're saying enthusiasm, passion, and someone said to me, they're like, do you think you're passionate? I was like, no, I don't know. I don't know. I know that can actually be seen as a negative. So it's like, I just think this is right. And I think this is good. So it's, it's just constantly finding creative ways, as Lisa just showed so beautifully. Clever, creative thinking, you can come up with really simple ideas and they just work. I feel like that project, Lisa, easily could be statewide and easily could be something that you do annually, the whole state. Like, it's brilliant. So ongoing conversations, there are limits in terms of Galkangu. We're in a Gov hub where a lot of it is like that is state level and that is related to the office infrastructure, which we have zero say in, sort of. So that's tricky. But
keeping it on the agenda.
Keeping it on the agenda. Thanks.
Yeah, that's part of our role, isn't it, as primary prevention practitioners and advocates and allies. So we have come to a beautiful kind of natural resting point. If you have further questions for Felicity and Lisa, please do keep putting them in the chat, and we'll send them through and get some answers for you. And just a reminder, we are recording this, so you'll be able to rewatch Felicity and Lisa's presentations, when we send the recording. There's another little question there for you, Lisa, which, if you want to reply in the chat to Donna, that might be awesome. And we're going to encourage you all to take a quick comfort break and come back to us at 11:30. Okay. So I want to introduce Tarang Chawla. Tarang doesn't really need introduction. Actually, some of you know him quite well from last year's 16 Days webinar. But for those who may not know, Tarang is a speaker, writer and recovering lawyer who serves as Commissioner at the Victorian Multicultural Commission and is the co-founder of Not One More Nikki, a grassroots non-profit working to end men's violence against women, named in memory of his younger sister, Nikita, who was murdered by her partner in 2015. Tarang is also a sessional academic at Monash University. He wrote, produced and hosted the acclaimed podcast There's No Place Like Home, and advised both state and federal governments on family violence reform and effectively engaging men in gender equality. So we're in very safe hands. And it's my pleasure to hand over to you and welcome you, Tarang.
Thank you so much, Hayley. It's lovely to see you and lovely to hear, Felicity, your presentation, and also to be joined by so many champions and advocates within the sector today, particularly at this time where we are grappling with this notion of how we better engage men in gender-based violence prevention in a way that is pro-feminist and pro-social, but also accounts for the diverse lived experiences of men. And so I'm thrilled to be joined by an incredible panel today. But before I introduce those panelists, I want to take a moment to acknowledge that I'm joining you from the lands of the Wurundjeri people of the Kulin Nation and pay my respect to elders past and present, and to any Aboriginal and Torres Strait Islander people who may be on the call today. And also acknowledge that when we talk about gender inequality, the intersectional components of that mean that First Nations women and First Nations gender diverse people are disproportionately impacted compared to the mainstream population. So that's something I think it's really important to say at the outset. In terms of housekeeping today, please, as I introduce the panelists, feel free to ask questions in the chat. We want it to be interactive, and we'll get to them throughout the session. But without further ado, I'd like to introduce our two panelists, starting with Hazel Donley. Hazel is a senior advisor of research and translation at Respect Victoria. Hazel's worked across several projects investigating men's experiences of social pressures to conform to masculine norms and what this means for the prevention of gender-based violence, including the Manbox 2024 study and Willing, Capable and Confident: Men, Masculinities and the Prevention of Violence Against Women. She's currently leading research on how to conceptualize the role of social media algorithms and online misogyny in young people's perpetration of gender-based violence, with a focus on AI-generated image-based abuse, which is an area that we see about in the news, but it'd be really fantastic to hear from Hazel firsthand about her experiences and what the research is telling us. And also we're joined by Dr. Innocent Mwatsiya, a research fellow with the Reducing Gender-Based Violence Research Group at the Violet Vines Marston Centre for Rural Health Research in the Trobe Rural Health School. Innocent's currently conducting research in the Partners in Prevention of Sexual Violence project, which received funding from the federal government to evaluate community-led primary and secondary prevention of sexual violence interventions across Australia. Thank you so much to both of you for joining all of us today. I know that we have gone roughly an hour, a little bit less, to have this conversation. So I want to get straight into it, if that's okay with both of you. Hazel, I'm going to throw the first question to you. But in doing so, before you answer, I want to say to everyone that this question isn't just for Hazel. This is for everyone to have a reflection on. But Hazel, the question I want to put to you is, what are some of the subtle ways that we, like society, police men and boys to reinforce harmful gender norms or stereotypes? And before you answer, I just want to say to everyone, take a moment to reflect, throughout the panel discussion, maybe share your thoughts in the chat as well on how we are policing men and boys. So what are your thoughts on that, Hazel, and what's the research telling us?
Yeah, so thank you so much, Tarang. And yeah, before I begin as well, I would also like to acknowledge that I'm coming to you from stolen land. I'm on the lands of the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to elders, past and present. And acknowledge the kind of ongoing care for country and for community that First Nations people continue to do here in Naarm, and to pay my respects to all First Nations colleagues joining us today. In terms of how we police young men and boys, I'd just like to start by saying we police people of all genders. And I think, in policing one, we create that binary. So we're policing girls and women just as much as men and boys. So when we talk about it from such a young age. So we see young boys, the way that they're treated from when they are like tiny, tiny little babies, the way they're spoken about as, big, boisterous, strong boys, the way we talk about them as heartbreakers. We start with this socialization from such a young age. There's evidence about boys being literally thrown around more, like physically thrown around more than girls. This idea of strength, of girls as weak. It starts from the very beginning. We also have, there's so many things. There's socialization about emotion, which our report speaks to. There's this idea that boys don't cry, which continues to, we continue to hear regularly. I notice it in grooming and hygiene product packaging, which is, I just find hilarious. I Googled, men's hygiene products, and we got products called Manly, Bulldog, Manscaped, unrealistic body expectations we see for men and women, but we see it more and more now in terms of these pressures to be so muscular. It ties into this strength and this acting tough, this really high levels of testosterone that we're expecting from men. Yeah, it's even in things like, I'm talking to my partner about this, the wanting to go to a bar and order a drink that isn't a beer and not feel like you can, and feel like, that you can do that without being judged by the men around you. It's just, the tendrils are everywhere. And I also want to say that we police men and boys with so many other intersections of power and discrimination. So boys from different backgrounds, different classes, different races, Aboriginal boys are all policed in really different ways, and we need to also keep that front of mind when we talk about these gender stereotypes. But yeah, Innocent.
Yeah, wow. It's really shocking, isn't it? How it's not just like one area of society or the media that is policing men and boys in this. I think there's sometimes like a belief that it's just like what we see in advertising, or it might just be like certain public messaging, but it's everywhere. Like you touched on those grooming products and the way that products are marketed, but then the expectations that puts on men and the attitudes around men's like behavior and not crying and the expression of emotion. And I think it's really, really powerful thinking about the ways that men and boys are sort of policed, and also the way that gender norms are then damaging men's like lives and relationships as well. Like it's not just women that are bearing the brunt of the consequences, although overwhelmingly they bear the sort of harsh reality of the violence that men perpetrate, but men are also not benefiting from these systems and these structures. So I think it's really powerful, Hazel, to hear from you just the different ways that it manifests. And I know that Haley has popped in the chat to ask all of you what are the ways that it's happening in your workplaces and community settings, and we'd love to hear from you those reflections of how you're seeing it play out in your community. Innocent, I want to ask you something based on this report, because it shows that most men want emotionally supportive, gender equal partnerships, even when they're struggling to live them out. So that's like kind of that's their aspiration. They want that.
Yeah.
What are the types of messaging, like what can we do in terms of messaging, community-based activities, initiatives that can help men in regional areas like turn that willingness into something day to day? Because we often talk about these issues, but then we don't know what to do. So for everyone listening, what are the things that they can do, you know, in a region where family violence rates are sitting well above the state average? Are there tangible things that can be done, or are there differences in terms of messaging to help men get that? Because it sounds like that's what they do want, and that's what the research tells us. What are your thoughts, Innocent?
Thank you very much, Tarang. I wanted to also start by acknowledging that I'm joining in from the lens of the Wurundjeri people and pay my respect to elders past and present, and to also acknowledge that I think every time we speak about violence and these kind of topics, like, you know, behind all of these are lived stories and lived experiences of real people who experience this violence. So I want to acknowledge that, and to acknowledge the amazing feedback and input that we receive from, you know, people's lived experiences and in different ways to, you know, to further this work that we do. So, I think when you were talking, I was like, I'm probably, you know, gonna add on to the problem than, you know, and maybe go into some solutions, because I always reflect on this idea that you know, being on a panel gives this this expectation of expertise, but, you know, which is very disappointing when you get people like me who are more passionate than experts in anything really. So I think more than anything, I think there is definitely, from the Willing, Capable, and Confident report, that idea that, you know, men are willing, you know, they're not always capable, and they lack the confidence to embody these relationships that, you know, that they want. But with that, I think the first thing to acknowledge is that this lack of capability or you know, of confidence for men to enact these things, it's not only just a, you know, a matter of personal failure or, you know, lack of motivation, but it's actually reflective of systems that require men to enact these things. So, you know, if you've had the unfortunate experience of listening to me, one of my favorite systems is capitalism, which is one of the systems that really requires, in Hazel knows, so which is one of the systems that requires these attributes that we keep fighting on a day-to-day basis. The attributes that our system of production, which is capitalism, requires men and other people to be dominant and to have control over others. So we in essence have a system of production that requires these attributes from men. And so we need to acknowledge that when we don't want men to be you know, to be stoic, to be, you know, to take control and to have, you know, power and all of this, just acknowledging that these are all attributes that are rewarded in the workplace. In the workplace, men are rewarded for being in control, for being powerful, for being assertive, because it makes money for capitalists. So when we talk to men and when we encourage moving away from this, it's also important to acknowledge that these are men, and these are behaviors that are being enacted within a system and within this ecosystem of reinforcement that is reinforcing certain attributes and that is demanding men to be a certain way. So I think that's an important starting point to acknowledge that, you know, to move away from the individual a bit and to focus on how, you know, our systems of production require these things from not just men, but from all of us really. And I think it's important to acknowledge. But in saying that, I think when we look at the report and when we look at the fact that there's already strengths, so there are already things that men are doing and men are seeing that, oh, you know, I want this kind of relationships. And for me, that's a very good starting point for having these conversations about, you know, these are already things that men are doing. So as opposed to framing prevention as a sacrifice or, you know, as something that men are departing from, but this is a platform to build on. So this is about men strengthening their relationships, strengthening their families, and strengthening their communities, which is an active code that recognizes things that men are already doing, because we know from, the Manbox study, we know from the Willing, Capable, and Confident report that men are willing to do, men are able to see, and they've got the willingness to do. But then, and that gives us a platform to say we are, emotional openness, for instance, as opposed to being a departure from masculinity, it's a deepening of masculinity, because it's already things that men are doing, and it's things that men want to have in their partnerships and want to have, as fathers, as brothers, in workers, and in all other platforms. So I think it's important to to ground that this is not a taking away from, it's not a zero sum, you lose, someone gains, but it's rather a building upon things that you already want, and to focus on a collective model of care, which we see in Indigenous knowledge systems. That is, it's about community, it's about other people around us. So I think those are important things to ground our thinking in, that it's not just individuals, but it's about communities, and men are already willing to contribute to communities around them and to make them safe.
That's so powerful to hear that, Innocent, because I think that some of the rhetoric that I've experienced in these conversations is that these might be like, qualities or attributes that are not stereotypically or traditionally masculine. But when you think about it, care for the community is actually quite a traditionally masculine, like, provider role, and community-based activity is actually quite a traditional provider sense of role that men have occupied across cultures and across generations. So it's not actually, like you said, a zero-sum game where someone wins and someone loses, but it's about harnessing the qualities that we know exist within masculinities over time that have actually benefited whole communities, men included. So I think it's really powerful the way that you articulate that. I've also realized, Hazel, that I may have jumped the gun a little bit in asking you the first question, and started talking about a report, not knowing that not realizing, that everybody's probably not as familiar with the report as we all are, or at least you are. You both definitely are as co-authors on that. But did you want to give us a bit of an overview of the report, perhaps, and then we'll kick on with a few questions after that?
Yeah, for sure. Thank you so much. I was going to jump in and ask if I should do that, because I have prepared a presentation for you all, because I think there's so much juicy stuff in that report, and I think it's 120 something pages. So I'll distill it down. But yes, thank you, Tarang. I will share my screen, and just give me 2 seconds. Oh no, I'm not going to be able to do it. Here we go. How's that? That looks good, I think. Can you see? Can you just give me a verbal yes?
Not seeing it yet.
Oh no. Okay. Now, yes. Okay, perfect. Great. So yes, I'll jump straight in. I want to tell you about some of the findings of the report, Willing, Capable, and Confident. This report explores some of the ways Australian men experience, navigate, challenge, or conform to masculine norms across different aspects of their lives. And we've already kind of started to talk a bit about that. I also just wanted to highlight some of the opportunities to build men's sense of their own capability to engage in preventing gender-based violence, and to understand the importance of their role in our collective efforts to end this violence. Just to let you all know, the report is an output of the Manbox 2024 study that we Respect Victoria conducted in partnership with the Men's Project at Jesuit Social Services. It focuses on Respect Victoria's analysis of 7 focus groups with men aged 18 to 45 from around Australia. We wanted to generate a range of perspectives about navigating masculine norms based on common experiences. So we categorized men into different groups based on age group, whether they identified as gay, bisexual, transgender, or gender diverse, whether they were employed in different jobs and their study status, and whether they were a father. We organised men into groups based on how strongly they believed in a set of stereotypical masculine norms, because we wanted to try and reduce the risk of conflict over differences in belief systems that could have derailed the conversation. So we asked these men about their perceptions of masculine norms and influences, expressions of emotional vulnerability, expectations for intimate partnerships, which Innocent's spoken to a bit, and intended active bystander actions in cases of homophobic bullying and street harassment of women. So when undertaking this research, we were really driven by wanting to contribute to important conversations such as this panel that are already happening across the country about nuancing what we mean about engaging men in prevention efforts. Our analysis of the focus group transcripts was guided by the settings outlined in Our Watch Has Changed the Story, places where people live, work, learn, socialise and play. Specifically, we were interested in how men described experiencing different social pressures in different contexts, settings and relationships, the discrepancies between their beliefs and their behaviours, and their internal conflict or ambivalence about their own contradictory beliefs. So the title of Willing, Capable and Confident and the discussion throughout the report draws on the conceptual model on this slide as a guiding framework. This model, published by Casey and colleagues in 2018, outlines 3 complementary categories of engaging men in gender transformative approaches to violence prevention. Through our report, we deliberately emphasised the idea that a significant number of the men we spoke to described being willing to challenge harmful masculine norms, yet they did not always feel capable to act on this willingness, or they lacked the confidence to do so. So, guided by this framework and a strengths-based approach, our report focuses on advancing the primary prevention sector's understanding of how to support men to critically examine and explicitly challenge the harmful gender roles, practices, norms, structures, and systems in their lives. So, one of the things that struck us when conducting this research was the different ways that men, without using the explicit language of the drivers, described how the gendered drivers operate in their lives and how they frequently felt uncomfortable but didn't know how to challenge them in the moment. The quotes on the screen illustrate some of the ways in which men described how the gendered drivers played out as different pressures in their lives, as well as in the lives of others around them. Men described experiencing pressure to condone violence against women and to enact stereotypically male behaviours such as not crying in public. They also described being aware of how other men can control their wives' and partners' independence and the various messages that promote different forms of male dominance, aggression and control in the places they work, live and play. But these pressures, these dominant messages about what it means to be a man in Australia, inform how men adjust their behaviours and the attitudes and beliefs they express in different contexts. So men across Australia experience pressure, we know, to conform to rigid ideas about the right way of performing masculinity. In the focus groups, men described a range of masculine norms that they feel pressure to conform to. 3 of the strongest themes were the pressure to act tough and restrict their emotional range, the pressure to be the financial provider or breadwinner, and the pressure to comply with heteronormative expectations and eschew feminine traits down to the breed of dog they own or their use of moisturiser and sunscreen. The slide on the screen has 3 quotes which illustrate how men described the pressures they experience to conform to these norms. For example, quote, "If you say I'm a house husband, I don't know how the other people will see it, right? They will still think, are you good enough?" It's really sad. So we know from the evidence, including the Manbox 2024 study, that men may choose to conform to particular masculine norms even when they do not personally agree with them. Willing, Capable and Confident discusses some of the fears that shape men's choices to conform to, act against or otherwise remain ambivalent to different social pressures of masculinity. It also reminds us of the value that men place on their social safety and on different relationships in their lives. Engaging men in primary prevention means acknowledging the richness of their relationships and the ways that protecting a sense of belonging can shape men's behaviours. Where men feel greater pressure to conform to harmful gender norms, the value they place on maintaining these relationships and their social safety can mean that they dismiss, ignore, reinforce, or encourage violence-supportive attitudes and behaviours. So the quotes on the screen demonstrate how 2 participants in our study described how they might change their behaviour based on their perceptions of the expectations of others around them, in this case their peers, but also their partners, family members and colleagues. For example, quote, There's also fear that if you do step in, are the rest of the group going to back you, or are you going to be the one person that is sticking up and alienating yourself? This first quote clearly highlights this idea of the fears that influence how men navigate different masculine norms in different contexts. This included the fear of social exclusion, judgment, or rejection from others. The second quote shows how men might choose to protect their social relationships over acting on their personal attitudes or beliefs. So while harmful masculine norms still have tangible impacts across our communities, it is a testament of our collective efforts that some men have begun to question and challenge these norms and to seek out different ways of being a man. While we found that men's sense of their capability to take action varies across different contexts, the slide on the screen shows that as fathers, within their peer groups and workplaces, many men continue to demonstrate their willingness to take action and have been inspired by other men around them doing the same. For example, quote, "One thing I was shocked by was with my boss. A few of the boys were going through some hard stuff and he took the time to pull everyone apart separately and ask them how they were. That makes a big difference." So through this research, we identified 5 key opportunities to create an enabling environment for men to reshape healthier masculinities and participate in primary prevention. Each of these 5 areas represents a context in which men can reshape social norms and push back against social pressures for men to behave in certain ways. We want to emphasise that many of you who work in this field will see your work, expertise, and experience reflected in these findings, and they may affirm things that are already embedded in your work. The first finding is that men see and understand the benefits of emotionally supportive, safe, and equitable intimate partner relationships for their partners and themselves. This finding talks about the importance of supporting men to acknowledge and express their full range of emotions in healthier ways and to learn about different approaches to resisting stereotypically gendered roles in relationships. The second is fathers understand how gender norms can influence their parenting and impact their children. This finding highlights the importance of ensuring parenting initiatives are inclusive of and resonate with men across their life course, supporting fathers to build positive relationships with other fathers, and supporting them to reflect on and challenge intersecting forms of bias that influence their parenting, like transphobia and homophobia. Third, men's families and social networks can support them to let go of harmful ideas about what it means to be a man and encourage healthier expressions of masculinity. This reflects that men's families of origin and different social networks are contexts in which they have learned about and often grapple with expectations for how men should behave. This finding talks about the need to build better evidence about effective approaches to help men enact healthier masculinities with peers, colleagues, and family members. It also highlights the need to support men to examine their resistance to normative change and to counter resistance from others. Fourth, mental health promotion efforts can motivate and enable men to practice healthier expressions of masculinity. This reflects men's discussions of how mental health and well-being for men is becoming normalised and accepted in various parts of their lives, in the media, with peers, and at work. But we suggest that this public discourse about mental health could be more explicitly linked with discussions of healthier masculinities in ways that support primary prevention. And finally, workplace initiatives, cultures, and reforms can empower men to practice healthier expressions of masculinity. Men in the focus group spoke about how workplace cultures are being reshaped through role models, management, workplace policies, as well as by who they work with and the diversity of voices around them. This finding highlights the importance of continuing to develop structural and systemic workplace reforms that challenge harmful gender norms and to build workplace cultures that foster healthier masculinities and encourage men to take advantage of parental leave and flexible working arrangements. So taken together, these 5 findings emphasise the complexity of men's masculine identities and relationships and how men may enact or resist different ways of being a man in different contexts. Their individual beliefs and behaviours are influenced and shaped by their families, peer relationships, and social networks. It emphasises the importance of keeping this complexity of masculine identities visible when thinking about engaging men in primary prevention. Our report highlights how engaging men meaningfully in prevention requires expanding beyond work with individual men and finding ways to leverage these complex and multifaceted social networks to build a critical mass of support or normative change that supports healthier versions of masculinity. Population-wide efforts are required to complement changes that may be achieved through prevention work with individual men in order to transform the social environments where masculine norms are shaped and practiced. And so this affirms the important role of mutually reinforcing primary prevention efforts that engage with men as individuals while also addressing these social systems, structures, organisations and communities that create and enable these masculine norms. So that is all from me on the findings of the report. Thank you on behalf of the team at Respect Victoria and my co-authors, so Innocent Mwatsiya, who wrote the report with us, and Shelley Macleff and Stephanie Lusby. And we can go back to you, Tarang. Thank you.
Thank you so much, Hazel. There's so much in that report, right? I want to ask you about one of the findings, because you talked about the different opportunities to collaborate and get men involved. And I think it was finding 3 talks about the power of friends and family to normalize healthier masculinities. I know that I've tried to have conversations with family and friends around this, and I'm met with sometimes enthusiasm, other times resistance, and sometimes ambivalence, what, I've got enough on my plate already. But clearly there's power in friends and family to normalize healthier masculinities. The research is showing that, and I'm sure the lived experiences of everyone in this forum would probably attest to that. But how can we harness the places where people spend their time? Say it's a football club, netball club, CFA, men's share. It doesn't really matter what it could be anything, right? But how do we harness that space to embed these conversations that actually challenge gender stereotypes?
A good question and a big question.
Sorry.
And no, it's good. These are the questions, these are the conversations we need to have and we are having. And so acknowledging upfront that there's already a lot of really great prevention initiatives that are happening, for example, in sports settings, because we know, especially in Victoria, we're a really sports-centric state, well, country really. So Gen West, for example, has a program preventing gender-based violence through sport. There's also organisational change work underway in emergency services through Champions of Change. So there's work happening. We know that meeting men and boys where they're at, in places they spend their time, is critical. So Our Watch, they have their wonderful Men in Focus report, and they developed a suite of practitioner resources. And I would encourage everybody to engage with those resources, because it's really tangible, kind of how can we do this work on the ground. But we know that transforming masculinities is best when it comes from within the group. So really kind of understanding what masculine identities men are holding, and tapping into who has influence within those group dynamics is really critical. So we're seeing more about, we've heard boys who have gone through respectful relationships education, and they've heard all the messages and they just don't care and it's not sinking in. And then a player from their favourite football team says it and suddenly it clicks into place. There is something that, it's pretty disheartening if you're an RRE educator to hear that. But there is something about the people who are within that social group. We talk about identity theory, but people who are within that group changing the norm from within the group, and that has a lot of power to it. I do also want to say one of my clever colleagues made sure that I note that we need to make sure that the work that is done in those settings is safe and expertly facilitated to ensure that there's no collusion between men. And there's some really great resources for practitioners as well. There's one called Working Together with Men that's been applied in practice by Women's Health Grampians through their men's initiative. Yeah,
wow. So clearly there's so many different opportunities across settings, right? And I guess the flip side of this is, at the very start we put in the chat to challenge you to reflect on ways that we police men and boys to subtly uphold gender stereotypes, right? And Lisa popped in the chat something which I thought was really interesting, as well as Simone. As well as Simone, yes, and then also Jacqueline. Jacqueline wrote that like young boys, even at a toddler age, have their friendships with young girls being labeled as romantic, and people saying, your girlfriend, you're going to marry her. And it sets up this heteronormative view that boys should only see girls as potential romantic partners, not as friends, and that mixed gender friendships are abnormal. And so I guess that is the flip side, that in these, family settings and these settings with friends among our peers, we're reinforcing certain stereotypes or certain heteronormative ideas. But we also have the opportunity to do the opposite of that, which is to positively reinforce healthier masculinities, and validate expressions of vulnerability from boys and men as well, which is, I think, what you touched on before. And then Lisa pops in a really interesting reflection on how several entries of young boys in a recent photo competition, where the boys were showing qualities of softness and gentleness, they were more acceptable for young boys to behave that way, but it changes as they age. So the idea that eventually you have to man up, right? Like, it's okay if once you're a boy, you can behave in ways that are more attuned to how you're feeling as a human, but you have to mask those emotions as you get older, and you have to suppress that in order to be, quote unquote, a man, which I think is a really, really interesting one. Donna Baldwin has popped in the chat. What do you mean about the risk of collusion? I wanted to ask you that as well, just so we're all on the same page. Hazel, what do you mean about the risk of collusion?
Yeah, so we can talk about collusion in different settings, and so it's often talked about in sorry, I'm going to lose my language. So perpetrator intervention work. So the idea that a perpetrator who's taking part in a program might say something that is then affirmed by the facilitator, either through language. So it might just be like, a person not thinking might just be like, yeah. And that kind of tells that person that, yes, that was, I'm affirmed. Yes, I can still behave that way, and someone agrees with me. So it can be in that sense. Collusion can also be really subtle, just in like a tiny little nod of the head. It can be anything that kind of sends a message to, in this context, the perpetrator, that their attitudes and their behavior is acceptable, even if it's not explicitly acknowledged, but like, yeah, I see you, and it's fine. So collusion in that sense. And then when we talk about collusion for prevention work, so kind of trying to disassemble these gender norms and stereotypes, it's the same practice, but it's more subtle, and it's about agreement with gender stereotypes. So, somebody might make a comment about, a homophobic comment, for example, and even if it's not like explicitly agreed with, there might be something in the facilitators, kind of the way that they are facilitating that conversation, which makes that person go away going, yeah, that's fine, I can hold that view, and not being challenged in it. Did you have a
subtle reinforcement?
Yeah, basically.
There's not really the most reliable person on pop culture references, but there was a recent I think everyone would recall the recent was it a radio interview where one of the presenters was going on about like the female soccer team and comparing them to grade 10, and the rest of the studio were just laughing and no one called that out. So that would be a clear example of collusion, because that signals that that's an okay thing. I can say that within this space, and people are laughing, so I'm getting acceptance from my in-group, so that's an okay thing to say. So and I think as well within prevention, because what we want to do is to have work that's gender transformative. So we don't want to collude with systems in the sense that are reinforcing, for instance, the fact that men only play sports and drink beer. So we're just gonna target men in sports and in pubs and in places where they are, but actually recognizing the diversity of masculine identities and the fact that you can do prevention in other settings which are not, and they're actually encouraging those spaces to be spaces where men feel like they can go to, and not reinforcing the stereotypes that, men should be welcomed only in prevention and if they take up leadership roles. So I think there's so much to be conscious around, are we not reinforcing gender stereotypes when actually what we want to do is undo and challenge some of them.
Yeah. You raise a really good point there, Innocent, which is around I guess the settings that men are in, and not just that men like beer and sports, so we need to be at the pub or at the football ground, right? Men are all the spaces that men are in. And so, Hazel, I want to throw a question to you, right? That there are local teens that are seeking connection online rather than in person, right? That's where a lot of young people, not just boys and men, but young people generally spend a lot of time seeking connection online. Part of it could be like particularly coming out of the COVID pandemic, where they were almost forced to just connect online, that now they've learned that maybe more than previous generations. But it's something that we've seen reflected through TV series like Adolescence, and clearly like the popularity of that, and the fact that this is something that like AI facilitated and tech-based image abuse is something that you're researching. So it's clearly like something that you're very invested in, and something that a lot of people are very concerned about. And so I want to ask you, I suppose, how do we counter the pull of the manosphere and like spaces for boys and men that give room for the lived experiences of young boys and men, but also model healthy masculinities that don't collude and that are gender transformative, as Innocent said? Are there any ways that we know that work, or what can we do? Acknowledging that this is a very new area compared to other aspects of primary prevention.
Yeah, thank you. It is a really new area, and there is a lot of research happening in this space, and we're really fortunate to be doing some of that ourselves. The E-Safety Commission as well has done a lot of research, and several universities we've been in touch with. But what a lot of that research has shown us, as you kind of allude to, is how quickly those social media, they call them recommender algorithms, how quickly they feed content to boys and young men that depicts those harmful masculinities. So we talk about Andrew Tate, but the Andrew Tate effect, so other influencers manfluencers who are kind of spewing some of this really kind of, I hate to use the word, but toxic masculinity content. So, but what we've also heard, which I do find quite heartening, is that some boys who engage with that content, when they realize that it's not them, it's actually the social media platform is designed to do that, to send out things that are polarizing and things that are engaging. They realize, some of these boys have said, oh, I thought it was me. I thought I was the problem. And so there is kind of this, there's an opportunity to kind of get in and say, it's not you, it's the system. The system is designed, it's capitalistic, as Innocent says, it's designed to make money off of your attention. So one, that I find that quite heartening. There was also some great research out of Project Rocket, which found that I think it was 60% of young people surveyed said that they would like to reset their algorithm if they had the opportunity to do so. And I think that's huge. I think there's
sorry to interrupt you. Can you just say that again so that we really get it? How many percentage of people would reset?
I think it was 60% of young people who were surveyed said that if they had the opportunity, they would reset their algorithm. And so I think there's so much willingness there to consume something different. But the opportunity is not there because you're just, it's just what's there on the internet, and kids don't necessarily know how to find more positive content, or, not necessarily knowing what's out there. So that gives me a bit of hope. But there's still a lot to do. So a few other things to say would be, a lot of people call for critical digital literacy skills. And it's not the solution, but it's definitely a part. Encouraging, teaching kids how to engage with that content in a way that questions the gender norms and stereotypes that are being communicated to them. teaching empathy as well. We talk a lot about, I know Innocent has spoken previously about the importance of active empathy, to be able to see who's being targeted in that content. So some of those, yeah, those are some of the opportunities. And I have one other note that I wanted to share, but just the importance of one, not recommending that kids stay offline. That's essentially an abstinence approach. We know it doesn't work. That's what the social media ban is trying to do. And I don't see it really having the effects that it says it will do, because kids will find a way. And so we need a harm reduction approach. And we need to acknowledge that being online can be a really positive experience for a lot of young people. And I know the Loddon Mallee region, it's a rural region for the most part. Rural kids as well, that's one of the ways that they connect with their peers and they can find opportunities for identity, and trans and gender diverse kids similarly. So yeah, not wanting to stay off it, but how can we make it safer, and how can we model healthier identity? So we're doing a lot of work in that space.
Yeah, fantastic, Hazel. And I think I couldn't agree more with the views that you've expressed around that social media ban, which I think is due to come into effect later this year. And I think one of the things about it is that having been a young person once myself, and a young man once, I know that when you tell young people don't do something, they want to do that very thing. And if you ban it, you make it all the more attractive a proposition. And so just simply banning social media is probably not going to have the intended impact, regardless of the, no doubt, I imagine, positive intent behind it, but it won't necessarily have the intended outcome. And I think it's so powerful that we actually act in ways that have a harm reduction approach for young people, and engage them meaningfully. So thank you for explaining that so well. I want to cast the net a little bit wider as well, and ask you, Innocent, about primary prevention organisations. How can they collaborate with, support local gender-based violence response services, whether it's the Victoria Police Family Violence Units, hospitals, healthcare sector, Orange Shore services? How can they collaborate to ensure consistent messages? Because there is that need for structural support. Then you mentioned that earlier, Innocent, about the structures that sort of fit together, and how they fit together. And I think it'd be really powerful to know, like, how can the primary prevention sector support the Loddon Mallee region for sustainable change? Because they're sort of overburdened as it is, or under-resourced, I should say. And so the primary prevention sector could do more, or like probably wants to do more. What are the ways to collaborate?
Thank you. I mean, definitely we'll fit capitalism in there. The underfunding of prevention is a deliberate decision that has been made. I always go to the fact that if we were here to discover oil or something that would give money, there would definitely be more funding, and there will be lots of red white men in the building and on the Zoom call. But definitely, because these are issues that are affecting women and other gender diverse people and men who have to live these masculine norms. The funding structures that we face are quite deliberate in that we're not being funded adequately. And I think the thing I was thinking about in relation to this question were a couple of things. The first being that even this divide of prevention and and response and early intervention and that kind of thing does not only just depart from how people live their lives. Like, people don't live their lives in those segmented ways where they're like, oh, now I'm preventing, now this is response. People live their lives in more continuous ways. And when we look at Indigenous knowledge systems, they reflect more this collective care model where, it's all about community well-being. So it's, there's no continuum where there's prevention, there's response, there's early intervention within, say, Aboriginal knowledge systems and within Indigenous systems all across the world. So I think this divide on its own is the reflection of coloniality and how we continue to exist within these systems where, there's an attempt to divide our lives or to slice our lives in these neat ways which don't reflect our reality really. So and I think so as a result, we have these things where the system funds and incentivizes people in different sectors to do different things. I moved to academia, and the moment I moved to academia, then you realize you're being incentivized to publish. When I was in frontline practice, you're incentivized to practice and not to reflect. In academia, you're not incentivized to collaborate and to reach out and to have those collaborations. So this divide and the ways that we don't work, I think it still comes back to funding models and a systematic problem where people are incentivized in different places to do different things. So as a result, in academia, you don't really have time to sit down and be like, oh, I need to collaborate, I need to do all of the other things. And in practice, when I worked in child protection, you barely had any time to sit down and say, I need to read the latest research on this because of what you are incentivized to do and what you are being paid to do. And I think that's quite a system design more than it's about us. So I think it's about advocating for funding models that allow us to meaningfully collaborate with each other, and advocating for funding models that allow practitioners, because practitioners know what's working. So allow practitioners and practice to be a site of knowledge and not just a site of implementation, because out there in the field is where people are doing work and people know what's working, and that needs to be considered and not really as, it needs to be filtered through the lens of research. We definitely need more meaningful collaborations that we have, than we have currently. And I think that we need to be advocating as practitioners within prevention for those funding models that allow us to do that. And much of that is going to be, a uphill battle of, going against the systems because of how money is allocated and the decisions that are made. But I think ultimately, we will continue to live within these systems where we don't reflect, and I think we need to have funding models that allow us to do better things.
Thank you so much, Innocent, for saying that part out loud about the funding models and how they often work in a way that doesn't enable or facilitate effective collaboration, right? And I think I think it's a really good segue, Hazel. I want to ask you about Loddon Mallee has one of Victoria's highest proportions of First Nations residents. So how can programs be co-designed with Aboriginal community-controlled organisations? Because we need programs to be culturally safe, and we need them to align with the report's call for intersectional approaches. Are there any ways forward that, like if you could wave a magic wand, what would you do to make sure that we can co-design effectively?
Well, if I could wave a magic wand, it would be funding, because the reality is those Aboriginal community-controlled organisations are woefully underfunded. So to engage them in co-design, that would be obviously the solution. And just to touch on what Innocent was saying about capitalism and the funding, it's really frustrating when we see we have to make an economic case for prevention, and that's the only way that we can get this work funded, is when we can see the actual cost to the economy of violence. When what about the human right cost and the anyway, I find that very frustrating in this work. So magic wand would be funding. I am not an expert, and I don't speak for the Victorian Aboriginal community, but I will speak to my knowledge. So there is a lot of work obviously underway, and Aboriginal communities have been doing this work for so long, and they hold so much knowledge about what works and what works in their communities. But also we know that First Nations practices actually work for everyone, and there needs to be more embedding of Indigenous principles into all of our work. So that would be, that's also a bit of a magic wand. Understanding that that First Nations conceptualization of violence is different to our kind of national framework approach, which is gender-based, and so changing the picture which describes what drives violence against Aboriginal women, talks about the ongoing impacts of colonisation and racism, and those are the things that we need to address. Gender is a part, but it sits lower down. So understanding that and engaging with those resources is so critical. There's also, the risk of over consulting these organisations, which again are underfunded and carry a really high cultural burden when they have white people knocking, asking for help. So being really intentional about what's the purpose of the consultation, building your own competency, educating yourself with the resources that are already out there that have been so generously shared with us. There are a bunch, and I can share them. There's been a lot of work done for the Delta Partnership Forum. And building relationships. So the importance of building a relationship between organisations in these regions before you need anything from them. So, the importance of going in and having a cup of tea and getting to know the elders of your community for the sake of building relationships and building community before you go in and say, anyway, and now we're doing this work and can you help me? That's what we hear from our First Nations colleagues is so critical. It's all about community and about connection. Avoiding any kind of extractive or transactional relationship. So the other thing would just be to say that a lot of ACOs, making sure that these programs that we're developing are strengths-based and that acknowledge the strengths of First Nations people that we do come in contact with, even if we're running a program that isn't, it's by a mainstream organisation, not an Aboriginal organisation, acknowledging the strengths, not a deficit approach, avoiding, obviously, all discrimination and stereotypes and prejudice. Those things are critical, building on those strengths of the communities that you are coming into contact with. There's a lot, but...
Yeah, thank you so much, Hazel. I want to ask one final question of you, Innocent, before I throw back to Hayley Davis. And it's that a minority of men are still dismissing gender equality outright. Right? Thankfully, it is the minority, but there are some men who are just like, nope, not for me, not for my community. What is the narrative that cuts through that most effectively? Is there anything that cuts through, and can we adapt that for use by local leaders so that those on the call today, in their conversations with other male leaders in the community, can use that to get the people who are not on board towards gender equality and primary prevention?
Yes, thank you, Tarang. I think a couple of things would be that piece that we've spoken about. Hazel spoke about it earlier, and we spoke about it around relational accountability, because at times we think of prevention as us doing things, but there's power in accountability that comes within the referent group, within relationships that people have. So that relational accountability of how we can influence the environment around men, so that they hear things from their friends and they hear things from people who are important to them. And so that there are so many relationships, which is what the Willing, Capable and Confident report shows us around partnerships, workplaces, as fathers in different areas. Men have these relationships which are very important and which make them reconsider their views. And so I think there's a part there that's about rethinking whether it's about that direct contact or whether we can influence relationships. And I think that relationship, the relational accountability means not flattening these men's experience, viewing them as brothers, as fathers, as workers, and not just creating this polarization of you are either for gender equality or you are against it, but actually finding that in reality there is space for contradictions, for complexity, and for change. And some men could be in transitional phases where they're grappling with changing identities, changing roles, and social expectations, and that needs to be grounded in how we think and how we approach people. And so when we do that, we leave space for mistakes and for redemption. And like I think Hazel said earlier, not all masculinities are given this grace of redemption and to make mistakes. We know that indigenous, African, Islam masculinities are still viewed as hyper masculine, as criminal, dangerous, and all those things, where they are not allowed to exist and to make mistakes. So in engaging people and in engaging all men, we need to create that space for men to be able to to connect, to understand they can be in transition, to question their things. Because when we polarize, what we do is we can push ambivalent and resistant men further into resentment, and they can just disengage and be like, I'm alienated from these conversations because they sound moralizing or they sound too elite for me. I cannot grapple with them. So I think there is that needs to view and to approach this work from that anti-racist, colonial, anti-power, like those kind of ways, where we are also questioning the ways that we're thinking and we are approaching men and not flattening their experiences.
Thank you so much, Innocent, for summing it up, and also for talking about the complexity of this work. That it does involve it does require spaces for redemption. It does require some of the messiness of being human and of being a man, and it needs to account for all those diversity of lived experiences and living experiences, and also remain intersectional in the way that it approaches men towards their involvement and investment in gender equality. And Hazel, to you as well, not only for the report, but for all of the insights that you've shared today. Thank you to both of you. We could continue this conversation, but sadly we're very much running out of time. So I'm going to throw back to Hayley Davis, and thank you to both of you, not only for the work that you do, but for living those values and for championing them every day. We're also grateful for you both sharing your expertise and wisdom with us.